The best qualification I have for giving this talk is I have a unique perspective. I see healthcare from two different angles. One, as the mother of two sons, a daughter-in-law and son-in-law who are physicians. And they are all really smart people. But if I ever had any reason to question their intelligence, I might have done so as I watched them take on hundreds of thousands of dollars of debt so they could go to school for an extra 10 years after college with the goal of working in a job where a third party dictates what they can charge. I watch them go to the hospital in the middle of the night. I see them miss tournaments, tennis matches, and basketball games, and choose time and time again to care for someone else's family member over their own. I've also had the privilege of watching the people in this room for all 5 conferences. Several times I've heard a doctor talk about a patient and cry. The way you care for your patients is palpable. I can feel it. The second thing that makes me qualified for this talk is that I am a patient. I know you've all been patients, but I have spent the last 2.5 years of my life in some kind of really crazy free fall. In the last few years, I have seen 19 different doctors, not counting the ones I saw in the hospital, had nearly 40 blood tests, scans, and images, and 8 visits to the hospital. You might be thinking, okay, either she's dying or she's a hypochondriac. Well, I am neither. I mean, we're all dying slowly, right? But not anytime soon. As I sat at this conference yesterday, I heard the following phrases. There are so many complexities to what we do. We don't have a healthcare system. We have a chronic disease management system. And we are working harder, taking care of sicker patients for less money. I can agree that our lifestyle, our food choices, combined with increasing amounts of bureaucracy, rising costs, and lower pay have made healthcare so complex that it's almost unsustainable. The current problems sometimes result in patients and doctors feeling at odds with each other. I've had a few frustrations with doctors and their offices. One time when I was 15 minutes late to my primary care, the receptionist said they would have to reschedule. And I am sorry to say that I let her have it. I started by stating, doctors are not the only people with a busy schedule. I also reminded her how long I had been a patient at that clinic and how many times I had sat in that waiting room for not 15 minutes, but over an hour. 20 years later, through listening to my children talk, I realized why doctors' offices choose to reschedule very late patients. 20 years later, I know that if my waiting room wait is long, it might be because the patient before me is in your office crying, and you just really cannot say, whoops, your time is up. I realize that every time you agree to do a procedure, you're taking a risk. I could list 100 other things that I understand now that I didn't before, but many patients don't understand, and even if they did, they aren't thinking of these things when they get a scary diagnosis. They have a million questions, but they know they can't call their doctor for every one of them, so where do they go? WebMD. And then they go from being scared to being terrified. I know from personal experience. And I cannot tell you how many times in the last 2.5 years I have laid awake spinning on those things I read on WebMD and on all the unknowns. Living with a new normal has been a little gut-wrenching. There was a lot said about teams yesterday. We are a team, you said. I hope you count me as one of your team members because we cannot afford to think of healthcare professionals on one team and patients on the other. In fact, as a patient, I believe that I am your most important teammate as much as you are mine. As I think of the doctors I've seen, I can honestly say this about all of them. They all cared. They gave me a generous amount of time, and they were all competent, all good teammates. However, there were moments when they sounded like they were not on my team. And here is a short list of things that you never really want to hear your teammates say. Well, these things do happen when you get old. I don't know why you don't have any energy, but I do know what I am doing, and I am giving you the correct medicine. Well, this treatment isn't working for you, but let's give it 3 more months and see if that will change. And my favorite, oh, you never should have had that surgery. You can laugh. I can laugh about it now. I didn't maybe when he said it. Despite some not so perfect moments, in general, I've had wonderful healthcare providers. When I spent 3 days at Utah Valley Hospital a few years ago, you'll be glad to know, Courtney, that I could not have asked for better care. I realize that's not everyone's experience at every hospital, and I found that out firsthand a few weeks ago when I traveled alone to Idaho. I mean, the following would have never happened in Utah. When I got to the hotel at midnight, I had a sudden attack of AFib out of the blue. I've had a few bouts of AFib before, but only in the month or so after I had a PFO closure. I called Gary and he said, "Mom, you're alone. If something more catastrophic happens, nobody will know. Go to the hospital." So I did, and the ER doc wanted to do a cardioversion. He explained the procedure and said I would need anesthesia. I told him, I am ultra sensitive to anesthesia. Please give me the smallest amount possible. He gave me 100 milligrams of ketamine. And I had the worst experience of my life. When I finally woke up, I could only make out a hazy figure standing by my bedside, and I heard the doctor say, "We tried it twice, but it didn't work." By the way, my heart rhythm reset on its own at 7 a.m. the next morning. Providers came and went in my room for the next 12 hours. I was super nauseated. Not one of them asked if they could help me or if there was someone they could call, and not one of them took a personal interest in me. I'm sure they were doing their job adequately, but it seemed like they were just going through the motions, except for one cute little CNA who kept poking her head in the room and asking, "How you doing? Can I get you some water? Here, let me help you with that. You have 18 grandchildren? That's amazing." That CNA, the person with the least education and the lowest wage, was a bright spot in a really dark day. And all she did was treat me like a real person. Little things matter. Now, before I close, I'm going to give you one request. Just one. Next year at this conference, I hope you will have a doctor-patient symposium where you make patients part of your many minds. Put them on your team. And this is the problem I would like you to work on. How can we as patients get a hold of you when we really need you? Because my biggest frustration with doctors is that they're sometimes impossible to reach. I know the reasons for that. But if we put our many minds on it, maybe we could solve that problem, and it would be amazing. Don't come back with the health portal as your answer. That's a rule. The portal cannot even be considered. It's adequate as a record storage place, but not as a communication device. I mean, imagine you were in the hotel service industry, and I called the front desk to ask for an extra blanket. I don't think you would get away with saying, "Get online, fill out a form, and we'll get you a blanket within 72 hours. Just saying. Now to close. This is Dr. Peterson, or Doc Pete, as we call him. He was my doctor for 53 years. He was there at some of the most seminal moments in my life. He was there at the birth of our children, and he was there at the death of my parents. That's my dad on the left. He was there when our 4-year-old daughter contracted cellulitis on Christmas Eve, and we spent the next several days in the hospital wondering if she would live or die. He was there when Scott got influenza 3 days before the state basketball tournament. And he followed up after Nate was hit by a wave runner at Lake Powell, and when Rebecca had her wisdom teeth out and the oral surgeon accidentally broke her jaw 6 weeks before her wedding. I can't even imagine what any of these experiences would have been like without Doc Pete. As healthcare providers, from CNAs to surgeons, you are not just an ancillary part of our lives. You are a lifeline. We need you, and we are profoundly grateful for you. I hope you'll remember that the next time you're exhausted, burned out, or frustrated beyond measure. May I leave you with my deepest gratitude for all you give and all you give up to make our lives better. You are the best of the best. And I don't think there is a group of healthcare providers anywhere in the world as extraordinary as you. Thank you for allowing John and I to be part of this for just a little while. It's been a privilege.